So, overview of trauma-focused cognitive behavioral therapy. These are the different components of TF-CBT that I previously alluded to. So, one of the first components is psychoeducation and parenting skills. And Melissa is going to dive into this component a little more, so I won't say too much. But the idea here is, how do we help people understand what happened to them and the impact of what happened to them? And then there's a focus on relaxation. How do we help people kind of get into a physiological state in which they are able to really be thoughtful about what their automatic thoughts are? If we're feeling very scattered, if our heart is racing, if we're feeling the need to pace, that sort of thing, it can be hard to concentrate on, okay, well, gosh, I wonder what it is that I am thinking and how I could maybe change the way that I'm thinking. So we try to teach people self-soothing and self-calming strategies. Then we teach strategies related to affective modulation, which, when we talk about affect, we're really kind of talking about visible signs of a person's mood. So, how do we help people learn to, have safe hands, right? Because a lot of kids, when they start to feel bad, might be pushing or shoving or doing other things that might not be very safe in the school setting. Then we teach people, even 3-year-olds, about cognitive coping. We teach them about the cognitive triangle. We teach them what automatic thoughts are. And we say, okay, here are potential situations that you might experience. And, if you saw another kid laughing, what might you think? Right. And oh gosh, kids will say a variety of things in response to that question based on their past experience with other kids, So, okay, you see a kid laughing. What does that make you think? And then we start talking to kids about what does that make you feel? And then how does that make you behave? And then we say, all right, just for fun, generate another thought that you could have, even if it's not a thought you normally would have. What's another potential thought somebody could have about that kid laughing, right? And then we kind of walk it through again to help them see that different thoughts can be associated with different feelings and different behaviors. I think it's really interesting when you do TF-CBT. Something I've noticed, especially the younger kids are, although this can happen with adults too, is often when we try to get people to identify thoughts, the first thing they will come up with is a feeling, I felt scared, right? And then that kind of provides you the context to really start to differentiate between that, what a feeling is and what a thought is. But I think thoughts and feelings coincide with each other so readily that it's important to spend time there. Since this is trauma-focused cognitive behavioral therapy, then there's also a module that contains a trauma narrative where children are asked to write about the scary thing that happened to them. And there's a lot of buildup to this component. There's a lot of assessing of readiness to engage in this component. It is, something that a lot of people, when they engage in this therapy, can feel some trepidation about. And so being very open and honest with people, I think from the outset about the progression of this therapy and how and when we might know when someone is ready to engage in that, or if they're ready to engage in it, is an important element of the treatment process. We also engage in, exposure exercises, much like you would in cognitive behavioral therapies that are specifically designed to treat anxiety. So anxiety can definitely occur even if there hasn't been a traumatic stressor that someone has experienced. And we know that facing our fears can be a way to overcome them. And so we kind of keep that theme alive here in cognitive behavioral therapy, trauma-focused cognitive behavioral therapy, although I'll be very clear that we don't re-expose people to their trauma, right? That is not part of the in vivo exposure, but some people will say, for example, that they have a hard time coping with trauma reminders, which we'll talk more about toward the end of the session. And sometimes, in order to go to school, trauma reminders are unavoidable. What if the trauma reminder is, a fire alarm on the wall. We're not going to be able to take those out of school settings, but what we can do is use graded exposure exercises to help children tolerate them better. We also have a component that's a conjoint trauma narrative. This can occur when this kind of refers to typically children will share elements of their trauma narrative with trusted adults so that trusted adults can be aware of not only what happened, but the impact of it. And so that trusted adults can be allowed to support more accurate cognitions about what happened. Sometimes the things that trouble kids are things that actually didn't happen, but that they thought happened during the traumatic event. And so involving other adults is really important in terms of making sure that everyone has an accurate understanding of what happened. And enhancing safety and growth. That's really where we want to get, is we want to restore a sense of safety so that children can feel safe enough to continue to grow and develop and not be what some people refer to as kind of stuck in the past and struggling to move forward because of these past life experiences. Typically, TF-CBT can be delivered in about 12 to 16 sessions, but depending on the complexity of the case, maybe you spend a lot of time on affect modulation, and that can elongate the treatment window. So sometimes it does last longer than 12 to 16 weeks. Often your sessions are about 60 minutes with a mix of working with the child only and also having the caregiver in the room.